What the heck are, well, screw that. Shit, cancel that. Darn it. This is embarrassing. You're an embarrassment. Sincerely, from my couch to yours, I hope you have a very healthy mouth. Couch dentist. Couch dentist. What the heck is a dental crown? An opportunity for you to make a bad pun about me crowning you king of the dental patients? I hope not. I've had patients say that to me. Oh, you're making me a king, are you? All right, well, yeah, all right. I wish I could endorse bad puns. I understand you're trying to make this fun for both of us, but that's a stretch. I'm gonna fake laugh, but I'm not gonna laugh for real. You know, as someone who uses puns on stage to elicit groans from audiences, the best I can do for you is fake laugh. Okay, what is a dental crown? A dentist says to you, you need a crown. What the heck does that mean? Some patients call these caps. I'm gonna cap your teeth. Let's put a cap on it. How is a crown different from a filling? Why are those not the same? A filling repairs missing tooth structure, right? You can lose tooth structure to dental decay, to acid erosion, due to an accident. You know, you chip a tooth. Maybe your tooth fractures due to biting on something hard. Maybe your teeth wear down because you clench and grind your teeth, or you chew on your fingernails, or pen caps, or whatever your particular obsession is, right? You chew ice, you put too much pressure on your teeth somehow, or you expose them to acid and carbohydrates in your diet, and your teeth are breaking down for whatever reason. So the way we typically repair teeth that are losing tooth structure is to remove the bad, contaminated tooth structure, anything that has decay, and then we reshape the tooth and build it back up with dental filling material. That sounds pretty good, you know? So why bother with all of this crown business? You know, why are we still messing around with crowns? Well, if fillings get too big, teeth can be more likely to fracture. A big filling in the center of the tooth thins out the walls of the tooth surrounding it, right? Thin walls tend to flex and bend and crack and break, and that's not good. Okay, so then how does a crown help? It's sort of like putting a hard hat over the top of the tooth. A crown encases the tooth all the way around, 360 degrees. That helps because now when you chew, instead of the walls of the tooth flexing out toward the sides and potentially fracturing, or the tooth splitting right down the middle, instead of that, the forces of chewing get distributed further down the rest of the tooth structure into the root and jawbone. The walls of the tooth are no longer the weakest link. It takes a whole lot more force to fracture the root of a tooth once it's protected by a crown. That doesn't mean it's impossible. I've seen it done, but in the years I've been in practice, I haven't seen it that many times. You know, it's pretty rare. It's not easy to crack a tooth root that's been properly protected by a crown. As long as there's an appropriate amount of tooth structure left above the gum tissue to support the crown, these hold up really well over the long term. If you have large fillings on back teeth especially, it would be normal for your dentist to talk to you about crowning such a tooth. You may protest and say it doesn't hurt, why would I do that? The goal would be to protect the tooth before it fractures and hurts. If you wait for it to hurt, you may very well end up just losing the tooth. That's not great, you know? If you're not sure if you should be crowning a tooth, then maybe get a second opinion from another dentist. I think that's reasonable in some cases. Sometimes you do get a warning that a tooth is starting to fracture. You can develop cold sensitivity on the tooth where it kind of zings you when you eat or drink something cold, but then it usually goes away really fast afterwards. That doesn't always mean the tooth is cracked, but it can mean that. You may also develop bite sensitivity, where you get a little zing on the tooth while chewing. Don't ignore that, right? A lot of people ignore that. Don't. Have your dentist check it out if you start to get a little bit of bite sensitivity. There are several ways dentists can try to detect cracks. Teeth with cracks refract light differently. We can use a super fancy tool called a bite stick, which is exactly what it sounds like. We have you bite down on that all over your teeth and see if we can recreate the sensitivity you're having at home. That can be a pretty effective way to locate a crack. The point is, crowns are best to put on vulnerable teeth before you have a problem. Now, does that mean that's how it goes down? Often not. I have lots of patients who don't believe what I'm saying or don't think it's enough of a risk to bother with a crown, And I don't have a crystal ball. I can't tell you for certain which teeth must get crowns and which ones must not. You know, I can't guarantee they're going to have a problem, but sometimes they do, and we end up losing a tooth or the tooth breaks, and I can still get a crown on it, but the crown doesn't have as much tooth structure as would be ideal, so it's more likely to break in the future too. I don't know, it's whatevs. Everybody's got to make their own decisions. A crown is a way to strengthen your tooth if it has a big filling and or cracks, fractures, or wear on it. It's a tooth hard hat. That's the bottom line. And yes, crowns are more expensive than fillings. Maybe that will change in the future. You know, people are experimenting with making crowns out of dental composite, you know, white filling material at this point. If those prove to hold up as well as porcelain crowns, maybe those materials will get less expensive. Who knows? However, the procedure still takes more skill and effort than your average filling, so that's another reason it can be a little bit more expensive. Some offices do crowns in 2 stages. At the first appointment, you have the tooth reshaped and a temporary crown is put on. You have to be careful about chewing with the temporary crown. It can break pretty easily if you try to crunch munch on it. Then you come back in a week or 2 for the permanent crown. Other offices do same-day crowns. They have a milling unit in the office that cuts the crown out of a puck of ceramic, and then they cook the crown in a little easy-bake oven and glaze it. It's pretty neat. And then you walk out with a new tooth that very same day. Both of these ways of doing things work. Both have their pros and cons. Depends on the situation. Either way, the end result with a crown can be really nice. What else might you want to know about crowns? Well, they can also be used to reshape teeth. That's pretty cool. If you have a tooth that doesn't look the way you want it to look, you can drastically change the appearance with a dental crown. Pretty spiffy. Sometimes that can be done with ceramic or composite veneers as well. I'll have other videos on my channel about that. Sometimes a crown is more aggressive than just reshaping the appearance of a tooth with a veneer or dental composite bonding. Sometimes you do need to do a crown. It all depends on the situation, the position of the teeth, the bite relationship of the teeth. Anyway, that's probably enough info about crowns. Please ask any questions you have in the comments. If you want to avoid getting dental crowns and keep your natural teeth healthy, I also have other videos about that. The goal of these videos and the dental health tips playlist on my channel is to set you up for success in a dental office. I know very well the common inefficiencies and costly pitfalls patients run into in dental offices all the time. I want to help you avoid those. I want to set you up to be an ideal dental patient who knows how to find an ideal dental provider for you so that you can have an ideal dental experience. Now, I use the word ideal loosely because things in life can go sideways in a hurry all the time, but I want to help decrease the likelihood that that happens to you. I'm a huge proponent of preventative medicine. Most dental problems can be avoided with simple habits at home. I want to help you build those simple habits to reduce stress in the dental chair and help you avoid financial strain from healthcare expenses. I have a dental health tips playlist on my channel and linked in the video description. That playlist is full of longer, more in-depth videos to give you guidance on how to avoid dental problems and keep a happier, healthier, more functional smile. By the way, I also do stand-up comedy and I enjoy photography. What? Yup. So please subscribe to my channel if you want to know more about those things. I'll be making videos involving dentistry, comedy, photography, basically anything I enjoy that I also think you will enjoy and find useful and valuable and informative. I'm on Instagram at Comedic Exposure, and you can check out my website, anotherlazymillennial.com. That's me, I'm a lazy millennial, another one of them. If you want to find future info on comedy shows and albums I plan to produce. I'm on TikTok at Mike_the_dentist. Mike the Dentist. Please like, share, and subscribe to my brand. I'm not a person anymore, I'm just a brand. Please smell, taste, and feel my brand. It's a good brand. Thank you. I'm not wearing any shoes. Ha ha! Woo! Feet! Yeah, you probably were picturing me wearing shoes this whole time. You're like, this guy's gotta be wearing shoes. He's like a dentist, he's on a couch. Nope! No shoes!